Hello and welcome. What we're mainly going to look at is the health and safety aspect of both acupuncture and acupressure. The main focus will be on pressure, but however, there will be some aspects of health and safety within acupuncture in itself. A lot of research, or there's more research within the field of acupuncture than there is with regards to acupressure in itself. But however, both form of treatment is one of the safest form of treatment that can actually be applied, particularly from a medical viewpoint. So what we're actually going to learn from today is by the end of the presentation, you'll have knowledge and understanding of the health and safety of acupuncture and acupressure, knowledge of the adverse events that may well happen more so within acupuncture as opposed to acupressure, and also the indication and contraindication of both acupuncture and acupressure. Now, there have been quite a lot of research and quite a lot of studies that have been done more so on acupuncture. There's not been any extensive studies that's actually been carried out on acupressure in itself to say as to the safety and health and safety aspects of it. But however, if you look at the health and safety aspects of acupuncture, which is more invasive, you can see it is quite a very safe form of treatment. So if you look at the study by White in 2001, that basically demonstrated, after assessing consultation of 32,000, mainly looking at BMAS and the AACP, Acupuncture Association of Chartered Physiotherapy, what they basically found, there was only 7% minor adverse events, but however, no major adverse events. Another study was actually undertaken around about the same time, looking at professional acupuncturists, and that came up with very similar results after looking at 34,000 consultation. So overall, what it's basically being shown is that acupuncture in itself is very safe, and it's also being suggested in safe hands, it is, or should I say in skilled hands, it is a safe form of medical intervention. And that's mainly a lot of it's going to depend on the practitioner. If I look at my experience of when I published my first book in acupuncture and looking at acupuncture points and health and safety aspects of it, what I basically found that in most cases, it was situations where there had actually been poor intervention, primarily by the acupuncturist, and have not followed routine treatment or routine guidelines as to the depth of needling that actually needs to be carried out. And many of them was needling far deeper into areas that they shouldn't have been needling into. And that's where most of the problem comes in. I mean, particularly once you start looking at certain parts of the body, but we'll come on to that in a short while. But however, if you start looking at mild events, which is mainly what's being reported if you're looking at more acupuncture intervention, most of that is reversible. What you're mainly going to see from that is if you needle and you take the needle out, then you're going to get a little small bled of blood or hematoma or a little bruising. So in other words, it's nothing serious. It's quite reversible in a very short time period. The patient might feel a little bit lightheaded, dizzy, they may well faint. So it's not anything that's life-threatening in any particular way. Other more significant is where it may well need a bit of medical intervention. May say, for example, you've hit a nerve and they're getting soreness or burning from the nerve. Or sometimes the symptoms in a lot of cases may get worse before it gets better. So it may well last a couple of days. But however, it's not anything serious and it will resolve itself in a very short time. However, you have got more serious, which will need hospitalisation. Now, this hospitalisation may be more life-threatening, even to the extent that some of them may be incapacitating, to the extent some of it may well cause death. And there are a number of cases where there have actually been deaths. So if we was to look at the more serious traumatic events, this has been reported by White, and I've also found from my own experience of research, particularly when I was publishing my book, I found there was quite a number of serious events. The most common one is neurothorax. Again, that's down to the practitioner. If you're using longer needles than what's required on the torso, then yes, you are leaving yourself susceptible to neurothorax. Again, if you're treating on the torso, you should be pinching. I don't expect somebody applying acupressure to end up causing a neurothorax in a patient, because there's nothing invasive. You're not likely to puncture the lungs, so therefore you're not likely to cause neurothorax. However, You will see it in quite a few cases where people's doing dry needling technique, particularly on the torso, whether it's the back or the front, or even up into the shoulder in the trapezius muscle. If you go too deep into there, you are likely to puncture the lungs. So you do need to be careful when applying dry needling or fanning techniques within key muscles. One of the other areas is to the heart. Now, the key thing is, I remember when I was doing our research, and also as part of my master's degree, particularly in acupuncture, we had to go out to Leicester and needle into cadavers. And there you could see how deep, in a lot of cases, with the normal use of a 25mm needle, you're not really going to reach the heart. If you was to needle into the chest, and say if somebody's got a hole in the sternum, and you was to needle through that, then you're not likely with a 25mm needle to hit the heart. The heart has been shown in many studies to be at least anything between 4 and 6 centimeters down from the actual sternum itself. The only time you're going to hit the heart is if somebody was to present with an enlarged heart. So in those cases, if you're needling onto the torso and around the chest or anything like that, you're not likely to hit any particular organ unless the individual presents with an enlarged organ, and then you do need to be careful on that basis. But even so, you shouldn't be needling that deeply to be able to cause that particular problem. So these 9 cases that's been presented, these practitioners must have been using far greater, longer needles than what's actually required for needling on the torso, and they must have been going some depth in order to cause any problems to those particular structure. And these are mainly found, particularly what I found is looking at a lot of the research when it comes to the health and safety aspects. If you're looking more in the West and in Europe, there weren't any serious adverse events. However, if you're looking at some of the studies that I found in China and reports from those, it was mainly people who was practicing not within the cities and not within clinical health centres. It was mainly where there was out in the country, out in the sticks somewhere, and formulating their own form of treatment modalities and going beyond, further and beyond what actually needed to be required. So that's where you found a lot of these cases were actually being presented, but generally these cases shouldn't actually be come across. Now, blood vessels is going to be a common one. More so, you're going to see that in the leg. And particularly if you're using any dry needling techniques such as fanning into the leg or in vigorous needling, if you've got somebody on anticoagulants, for example, you are more likely to cause a lot of bleeding, and that's going to lead to compartment syndrome. So that does need to be careful. That same thing is going to apply if you're applying pressure and you're applying deep pressure into that region. Then again, you do leave those patients susceptible to bleeding and also causing problems there. So it is important that whether you're applying pressure or whether you're applying needle, you do need to be cautious if somebody's on anticoagulants or any blood thinning particular agents. If they've got deep vein thrombosis or anything like that, you do not want to be applying pressure and dislodge any embolisms or anything such as that. So you do need to be careful on that basis. Again, with regards to the brain, there were a number of cases that I came across when I was doing my research, and you'd be surprised, somebody needling all the way down to the medulla oblongata. So you would need to be using a reasonable length needle in order to hit the medulla oblongata. So there are cases there which patients or the practitioners shouldn't be actually doing. So these are people who's gone well beyond the depth of what needs to be done. If you're carrying out any particular treatment, then there is a guideline as to how deep you need to be needling, and obviously these depths are being ignored, even to the extent that I saw one particular literature where it was talking about a young boy being needled through the throat, and practitioner wondered why the patient passed away. So again, obviously it's as if they've made it up as they've gone along, but this was over in China and certain parts of China, but not in a medical or clinical setting. So it is on the level of qualification that acupuncturists will have actually received. I can only make that assumption. So, but however, again, once you start looking at the spinal cord is look at the vertebrae. Now, if you're going to needle over such as what you call your DROWSINESS channel that runs down the vertebrae, what you definitely don't want to be doing is needling up towards the head. It should be either going perpendicular or going down towards the buttocks. Therefore, you're not likely to go between the vertebrae. But even so, if you've got a 25mm needle, that shouldn't, even if you went right up to the hilt, in most cases, I wouldn't expect that even to get as far as the spinal cord. You would have to be using a longer needle in order to achieve that. So again, these are practitioners that's using a wrong length needle on the torso in order to achieve that. However, if you're applying pressure, not likely to cause those kind of problems. So if you look at adverse event, whether you're applying acupuncture or acupressure, sleepiness is going to be an important one. What you're basically going to get from that is patients is going to feel tired, mainly because of the stimulation of the acupuncture point or the acupressure point, and that's going to start to release endorphins into the system. And the release of those endorphins into the system is going to make the patient feel a little bit tired. In some cases, in both acupressure and acupuncture, I've had patients that felt faint. So it is important, regardless of which technique you're actually applying, ensure that the patient is in a lying position to ensure that they're not likely to faint, particularly on their first couple of treatment. Nausea can actually occur. I have had patients, not necessarily from applying acupressure, but when I've applied acupuncture before, where they've had projectile vomiting. So again, they can feel nauseous. All these is just indicating that they've had a strong response to the actual treatment in itself. And dizziness is something that may well start to occur, but then they may well start going from dizzy to feeling more faint. Miscarriage is also important. That's going to depend on the points that's actually being used. So it is important, if you do have somebody who comes in and are pregnant, do be aware of key points, that whether you're applying acupressure or whether you're actually applying acupuncture, you do need to be aware of those points. We'll cover those in a short while. So as I was saying beforehand, if the patient's coming for the first time, make sure you position the patient either in a supine or a prone position. That will significantly reduce the risk of that individual fainting. So that's going to be quite important. Also, make sure they breathe quite deeply while they're actually receiving treatment. So if they're taking deep breaths, that allows the patient to be more relaxed. It also allows the patient to be a lot calmer during that particular treatment, and therefore it facilitates a better treatment outcome. If you are dealing with somebody pregnant, it is important during the consultation and when they fill out the consent that you do have that on there, basically to find out whether they are pregnant and what stage of pregnancy they are at. So therefore, there are key points you do most definitely need to avoid. All your big points in and around the hand and feet should be avoided. Also points in the back, such as urinary bladder 31, 32. Also on the abdomen, REN 3 to 6, they should be avoided because they're going to have a direct effect on the uterus. And what you don't want to do is overstimulate those, which may well cause spontaneous abortion. Same again, your big points such as your large intestine 4 and also points such as gallbladder 21. Those 2 points have actually been shown to enhance cervical ripening. So last thing you want to be doing at a certain time of pregnancy is encouraging cervical ripening. Not too bad if they're going into labour, then you can quicken the whole process up. But however, outside of that, that is not something you want to actually be encouraging. So those kind of things you do need to be very, very careful on. So that's just something to be very much aware of with regards to that. Avoid, as I was saying, big points within the feet and the hands. There are a number of studies, however, which are just to make you aware of, where they have used large intestine 4 and liver 3 in a number of studies. Key thing about that, even though a lot of literature says avoid those points, I've seen maybe 2 or 3 studies where they have used large intestine 4 and liver 3 and they haven't had any adverse reactions within those pregnancy. But however, it's not something that I'd encourage, because if you was to get a claim against you, there's a lot of books and literature that advise you against it. So it's more or less you're going to have to provide the evidence to support your case. So that's going to be quite important to bear that in mind. Ear points, any ear points, that has an effect on the endocrine system. But I'd also say if the patient's going for reflexology and applying pressure to any points on the feet, that would need to be avoided if it affects the endocrine system and also affects any aspects of the uterus. So they would actually most definitely need to be avoided. So that's going to be one of the safest things to do, is avoid points in the low back, or avoid points on the abdomen, just to be on the safe side. I think a lot of it's going to be common sense. If you've got any malignant growths or post cancer, make sure you're not kneeling anywhere near any cancerous growth or previous cases of cancer. So, and again, that applies to pressure. You do not want to be applying any kind of pressure in and around those particular areas. Also important is you do need to be aware of if you're needling on the torso in any particular area, that people may well have enlarged kidneys, livers, or even heart. So you do need to be aware of that. So again, you shouldn't be needling deeply on the torso, just in case they have enlargements within those areas. So that's something to be very, very careful of. Infections, you should be avoiding any kind of infections, any kind of open wound. What you've got to take into consider also is if you've got any high-risk patients, diabetics, because their immune system is going to be compromised, mainly because of diabetes, or anybody on any immunosuppressants, if they're going under chemotherapy or anything like that, then that's going to leave them more susceptible to infection. So therefore, you do need to apply an aseptic technique, whether you're needling the area or whether you're applying pressure to the area. Make sure you clean the area well, make sure your hands are very clean, and you follow a very aseptic technique in what you're actually doing. So that's going to be quite important to ensure you do that. Drowsiness, once the patient's actually been in, you do need to advise them of regards to drowsiness. Drowsiness is something, as I was saying beforehand, if they've responded quite strongly to the treatment that you've actually applied, then they may well feel drowsy. They might not feel drowsy straight away, but let's say, for example, they do feel drowsy after your treatment. Some patients may even fall asleep on the couch, and you do have to wake them up. But however, some patients may not. But however, if they do start to feel drowsy, get them to sit in the waiting room. Once they've actually, gone out, sat in the waiting room and feel a bit more alert, then they can actually leave. If they're not feeling drowsy upon finishing, still warn them, and particularly if they've got any distance to drive, to say if you do feel drowsy, it would be wise to pull over. And then once you start to feel a bit better, then to continue your journey. So don't put your patients at risk once they've actually had any kind of treatment. So that's going to be quite important. Other contraindications. Now you have got points like on the neck near the carotid artery, where you've got points such as your stomach 9. Now key thing is you have got a node there that will actually start to affect the rhythm of the heart. So if you're applying pressure or needling around there, or if somebody's got an enlarged thyroid, then you do need to be careful in and around and don't overstimulate that particular point, depending on what course of treatment you're actually applying. Same again, if you're applying needling in particular to points up onto the shoulders, such as gallbladder 21, make sure you pinch. Any points on the torso, you need to pinch before needling. Try and needle over the rib cage. So that's going to be far better than needling in between, less likely to cause a neurothorax with a patient. Same again, points such as your small intestine, over the shoulder blades, that can have holes within the shoulder blade. Yeah, and that, if you're needling through or beyond that, that may well cause neurothorax. So don't make the assumption that a shoulder blade is just purely solid bone. They can have holes in there, and you can end up needling straight through that into the body and cause neurothorax. Same thing again with the sternum, and you'll be surprised as to the percentage of people. Some of them is quoted up to 19% in some of the studies that I've actually looked at. So on average, you're talking anything between 6 and 19% of the population is more likely to present with holes in and around those particular area. So that is just something to be aware of if you're actually needling. If you're applying pressure, not too bad, nothing to really concern yourself about, because you're not really going to go through and penetrate that and cause any real problems. So the other key areas to be aware of is if you've got somebody who come in, make sure that they're not intoxicated. Also, make sure they've had a meal about an hour after they've had a meal, but make sure they've not just eaten and overeaten and then come in and have treatment, because that is going to make that patient very tired. They may well end up passing out. And same again, make sure they're not coming in with an empty stomach. And particularly if they're diabetic, you definitely need to make sure, if you're going to use stomach 36, if they've got on an empty stomach, then they are more likely to faint. Reason for that is stomach 36 is one of your main points that allows long chain fatty acids to be taken up more efficiently by the mitochondrial cells. So therefore it's going to reduce the blood sugar even lower than what it would be, and therefore it makes that patient more susceptible to fainting. So that's just something to bear in mind. If somebody's had a stroke, make sure you've got the scan, MRI scan back, just to make sure that things are on the recovery before you start applying any kind of acupressure or acupuncture. Psychiatric patients, normally I wouldn't needle or apply pressure to patients presenting with any psychiatric disorders. I would personally normally use laser. I find that's more effective. It doesn't cause any discomfort or anything to the patient, and therefore it's not going to cause any major concern to the patient. As I was saying beforehand, abdominal points, if somebody's presenting with cancer or anything like that, you do not want to be using abdominal points if they've got any internal organs that's affected, just to be on the safe side, because you're not wanting to press and stimulate any of those particular organs in that respect. Other points, once you're looking at pressure or even needling, is avoid points in and around the groin, armpit, and also over the breast. Those points don't necessarily need to be treated. I'm sure there's 4 more other points that will have a greater effect depending on what you're actually treating. So thank you for listening. If you've got any questions, then do get back to me. You can contact me at info@stevebaileyAcupuncture.com.